There are 20,000 babies born in South Australia every year. If we follow just one of those birth cohorts up to age 10, 1 in 4 of those children will be notified to child protection. The BetterStart group is dedicated to improving the life chances of disadvantaged children in South Australia. One of the problems we're trying to solve is the absolute epidemic of contact with child protection systems. Kids don't get to choose the lives they get born into, and there are lots of disadvantages. They can be health disadvantages, you can be sick. There can be social and economic disadvantages, and even there are kids who are maltreated and sexually abused. So those disadvantages mean really tough starts to life, and our work is all around trying to describe some of those, but more importantly, how we can intervene to improve the life chances for especially young children. We're data scientists, we're highly quantitative, so we're engaged actively in designing interventions and testing them, as well as quasi-experimentally evaluating when interventions occur out there in the real world. One of the assets that we hold in BetterStart is the South Australian Early Childhood Data Project, which covers all South Australian children and their families from 1991 going forwards. That's fairly unique in the world, and so there's a lot of interest internationally in what data platforms like this can do to improve service delivery to disadvantaged children. Everybody knows there's child maltreatment, and that's child abuse and neglect. But none of us realise the scale of that problem until you start to use data like this. Over the last 2 years, we've generated more than 50 reports for different parts of government. 95% of those are cabinet in confidence currently, which means that they are actually feeding into the policy narrative and the programmatic narrative that's informing how child protection reform will occur in South Australia. In the end, every researcher and every academic wants to make a difference. And so the sort of work that we do, we feel like we're getting closer to making a difference. I'm John Lynch, and I'm an epidemiologist at the University of Adelaide.